Hello everyone, my name is Tigist Teshale and I am a Doctor of Nursing Practice candidate at Cal State Fullerton. Today I'll be providing an evidence-based overview of HIV pre-exposure prophylaxis, or PrEP, to support the implementation of PrEP services in our clinic. I'll review what PrEP is, who is eligible, prescribing considerations, and ongoing monitoring. What is PrEP? PrEP stands for pre-exposure prophylaxis, and it refers to the use of antiretroviral medication to prevent HIV infection. PrEP is prescribed to people who don't have HIV but may be at high risk, such as through sex or injection drug use. It works by preventing HIV from establishing infection in the body if exposed. Types of PrEP. There are currently 3 FDA-approved PrEP options, 2 oral medications, Truvada R, F/TDF, and Descovy R, F/TAF. Both are taken once daily. A long-acting injectable called Apretude, cabotegravir, given every 2 months. The oral medications are more commonly used, while the injectable option provides an alternative for patients who prefer not to take a daily pill or have adherence challenges. PrEP effectiveness. When taken daily and as prescribed, both oral and injectable PrEP reduce the risk of acquiring HIV through sex by approximately 99%. Among people who inject drugs, oral PrEP reduces risk by about 74%. Adherence is critical for PrEP effectiveness. Why PrEP in 2023, over 39,000 new HIV diagnoses were reported in the United States and its territories. The majority were among men, especially those reporting male-to-male sexual contact. Black and Hispanic/Latino individuals are disproportionately affected. This underscores the importance of offering PrEP as a prevention tool in settings like ours. HIV trends in Los Angeles County, October 2022 to March 2025. Locally, HIV continues to be a public health concern. The trend data shows areas and age groups where infections remain persistent. As a Los Angeles County provider, you're in a unique position to provide preventative tools like PrEP to vulnerable populations. When to recommend PrEP, CDC guidelines recommend that providers offer PrEP to anyone in an ongoing relationship with someone living with HIV, regardless of partner viral load or ART status, anyone who asks for PrEP, anyone with sexual or injection risk factors in the past 6 months. Importantly, anyone who requests PrEP should be offered it unless a contraindication exists, even if they do not report specific risk behaviors. What is oral PrEP? For oral PrEP is most commonly prescribed for individuals who have had condomless vaginal or anal sex, have partners with unknown or positive HIV status, have a recent STI, engage in injection drug use, or are experiencing intimate partner violence. Baseline assessments. Before starting a patient on PrEP, we need to confirm that they are HIV negative using a 4th-generation AG/AB test and consider an HIV RNA test if recent exposure is suspected. Other required baseline labs include STI testing, kidney function assessment, hepatitis B serology, and lipids in some cases. These labs ensure safe and appropriate prescribing. Simple clinical workflow. His is a simple step-by-step workflow to help guide your practice. Screen for eligibility, order baseline labs, counsel on options and adherence, prescribe PrEP with a 90-day follow-up, continue regular monitoring. We'll discuss monitoring in more detail shortly. Ongoing monitoring. Follow-up visits should occur every 3 months to renew prescriptions, test for HIV, and provide adherence counseling. STI screening and renal monitoring are done based on patient risk and age. This follow-up is key to safety and supporting patients in staying on prophylaxis exposure, or PrEP. Oral PrEP delivery checklist. Here's a quick checklist to help you integrate PrEP into your routine clinical practice. Always assess for PrEP awareness. Order correct labs. Provide counseling and set follow-up. This tool can be used as a reference or laminated for your workspace. if a patient asks to stop PrEP. If a patient needs to stop PrEP, counsel them that protection wanes within 7 to 10 days. This is important because exposure during that time puts them at risk. Encourage open discussion and a safety plan, including post-exposure prophylaxis PEP options if needed. Conclusions to wrap up. PrEP is a highly effective medication that prevents HIV when taken as prescribed. Every sexually active person deserves to know about PrEP, especially those at higher risk, such as individuals with a history of recent STDs, condomless sex, multiple partners, or those with HIV-positive partners. It's also important not to overlook women. They too are eligible for and can benefit from PrEP, especially in relationships where HIV exposure is possible. As healthcare providers, we must not only offer PrEP but also thoroughly document our conversations. The saying goes, if it's not documented, it didn't happen. Clear documentation shows accountability and ensures continuity of care. Let's work together, educating patients, increasing access, and improving clinical interventions to end the HIV epidemic in our communities. References. These guidelines and clinical recommendations come from the Centers for Disease Control and Prevention, CDC, and Los Angeles County Department of Public Health. Please refer to these documents for more detailed reference in your practice.